Good morning, Sir Fritz. I am Leslie Omandak, and today I will be presenting to you my research proposal entitled "The Impact of Continuing Professional Development Programs on Nurses' Performance in the Delivery of Care." However, my presentation is too small and is not visible. So I think it's best if I'm going to send it to you by email for your reference as well. And now I'm going to start with a short introduction regarding my proposal. What is CPD? CPD is, or Continuing Professional Development, is a continuous process of personal growth to improve the capability and realize the full potential of professional people at work. Examples of CPD includes workshop, conferences, undertaking research, distance learning and webinars, mandatory training directly relevant to a nurse specialty, and the likes. According to APNA, which means Australian Primary Healthcare Nurses Association, CPD is the means by which members of the profession maintain, improve, and broaden their knowledge, expertise, and competence, and develop the personal and professional qualities required throughout their professional lives. CPD has contributed in so many ways in the nursing profession. It improves the competency in nurses area of work, leading to accountability, reduces gap between the learned theory and the practice, and it also enhances the clinical competence and acquisition of new knowledge and skills. And in Malta, nurses are given 700 euros yearly just to attend CPD programs. However, there is no current study regarding CPD, and so I myself, I wanted to conduct this study so that I will be able to know the impact of attending these programs on nurses in the delivery of care. The purpose of this study is to investigate the impact of participation in CPD programs, and thereby supporting the idea that CPD is also necessary for safe and quality nursing care. The objectives of this study will be, for the general objective, the main objective of this study is to determine the impact of CPD programs on nurses' performance in the delivery of care. I have 3 specific objectives, and these are: first, what are the CPD programs attended by the nurses? Second, what is the perceived level of performance of the nurses after participating in CPD programs? And third, is there a relationship between participations to CPD and nurses' performance in the delivery of care? The significance of this study. The findings of this study will contribute to the benefit of the whole nursing professionals, considering that CPD plays a vital role in the nursing profession of today. The result will be of great benefit to the following: Mater Dei hospital administrators. The data for sure will give the managers the information on how CPD programs affect the nurses' performance in the delivery of care. The result will help the management to plan on deciding the nurses which conference to attend to and which area of practice to focus on. And second, to the nurses, the findings of this study will also provide information regarding the effectiveness of CPD programs. Furthermore, this study will also provide awareness to the nurses on their clinical performance in the ward. Third, to the nursing research or education. The assessment findings can be a potential source for further study. Findings of this study will also foster new strategies of enhancing skills, knowledge, and attitudes, thus strengthening the global competitiveness of nurses. And lastly, for the patients, because findings of this research will benefit the patient as they are the main focus of the recipient of the nursing care. The scope and limitation of the study. The scope area of the study will be in Mater Dei Hospital, which is here in Malta, and it will be limited only to the nurses who work full-time in the said hospital. And the study will be done through the use of questionnaire to the nurses as a survey and reference. The researcher will not be conducting CPD programs, rather the nurses will just answer the researcher-made questions assessed. Next is the review of related literature. Nurses are required to be competent, and we as nurses are the integral part of the healthcare system and is expected to meet the new demands arising in our field. And in order to survive the roller coaster world of nursing, we have to enhance our skills and knowledge, and that is through CPD. I have few literatures here on my presentation, and this is from Panti and Pant. CPD is a way to maintain and acquire current knowledge and skills in the rapidly changing healthcare environment. And according to the Royal College of Nursing, there is an international evidence that CPD is important for nursing staff in terms of their professional and personal development and in contributing to improve patient outcomes and increased public confidence. They also believe that it has an important role in creating a healthier and happier workplace, citing strong links between learning and well-being. Garofalo also explained that CPD requires a partnership between the learner and the teacher, and to be effective, it is important to identify individuals' knowledge gaps and learning needs. He also found out that CPD enabled the understanding of best practice, thereby resulting in nurses' improved performance to give quality care for patients. So much for that, and we have to move on to the theoretical framework. Theoretical framework. I chose the experiential learning theory of David Kolb. This theory is represented by four stage learning cycle, which are the concrete experience, reflective observation, abstract conceptualization, and active experimentation. You can enter at any stage, but you have to follow the logical sequence of the stages. The key concepts in this theory including the learning cycle, learning style, learning space, deep learning, and development can be used to examine CPD as a learning and development process at the level of the individual, the team, and even in the organization. This theory has been selected because it is because of its approach to learning. It requires to actively involved in the. It requires the participants to actively involved in the learning process, and which is very applicable to the CPD programs. In seminars, trainings, participants are directly involved in the experiences, and then they will reflect to the experience, and then they will analyze to better understand the new knowledge and information that they have gathered, and eventually they will use them as they go back to work. That's why I chose this theory. Next is the conceptual framework. Conceptual framework is used to arrive at a hypothesis, and the conceptual framework of this study is anchored on the concept that CPD programs is associated to the nurse's delivery of care. Next is the research design. The approach of this study is that of the descriptive correlation design. A descriptive correlation design was employed in the study to describe the impact of CPD programs on nurses' performance in the delivery of care, and to examine as well the relationship between those variables. This is a cross-sectional study that will utilize a one-time written data collection, and researcher-made questions will be also prepared, and there will be no manipulation to the independent variable to improve the nurse's performance in the delivery of care. Next is the sampling design. I will be using the random sampling, and this design will be used to ensure that there is an equal representation to the participants in the study. Stratification will be based on the job position of the healthcare providers, and that's the nursing officers or the head nurses and the staff nurses. The sample size, the study will be conducted to the 10 nursing officers or chief nurses, or head nurses, and 100 staff nurses in Mater Dei Hospital who works full-time in the institution. Next is the research local. The study will be conducted in Mater Dei Hospital, which is the largest government hospital in Malta. And this is the only general acute teaching hospital in Malta. And it is the main institution that provides acute healthcare services within the Maltese public healthcare system. It has 928 inpatient bed capacity and has 86 daycare beds. It caters all medical specialties, namely medicine, orthopedics, cardiac services, ophthalmology, pediatrics, ICU. I mean, all of it. All. And this hospital has been selected because this is the largest hospital, and also this hospital provides room for learning, training, and research. And this government hospital as well has been giving yearly CPD grants to the staff nurses for their trainings and conferences, even up to now. Next is the data gathering procedure. Before starting the survey, of course, the approval from the CEO and the nursing manager will be sought. Ethics form, informed consent, and samples of the questionnaires will be provided to them. And once it will be approved from the hospital administrators, I will then start the proper survey. The researcher will ensure that participants are willing to participate in the research and that it is voluntary. Survey questionnaires will be personally handed by the researcher to the nursing officers, staff nurses to complete. And the researcher will also be available to the participants for any questions that may arise during the whole duration of the survey. All participants will be given an ample time to complete the questionnaire, and confidentiality, of course, will be maintained throughout the study. And lastly, the ethical consideration of the study. This study is also subject to certain ethical issues. All the participants will be informed in advance about the purpose of this research and that their participation is voluntary. They will report their acceptance regarding the participation in the research throughout assigned consent. Participants will be informed of the confidentiality clause. Confidentiality clause means that the dignity of the subject, which is the participant in this case, will be always respected, and all the information gathered in the course of this dissertation will be used only for the purpose of this research and will be kept confidential at all times. And I think that would be all. And no, the last part is the plan for data analysis. Um, um, of course, during the study, the raw data will be collected, will be coded and entered into a computer program which is called the SPSS, or Statistical Package for Social Sciences, and will then be analyzed. Both descriptive and inferential statistic will be used in the study. Um, Frequency distribution, descriptive statistics will be used to sum up and categorize demographic variables such as age, gender, years of nursing experience, highest educational attainment, and how many times nursing officers and the nursing staff attend or join the CPD programs in a year. Correlation analysis will also be used to better understand the relationship between the two variables, and the data will also be presented in tables and figures once analyzed. I think that would be all, and thank you so much for your time, and I see you in the Philippines soon.